Okay, guys, we're going to go ahead and get started, and I will let people come in. I want to be conscientious of all of our time tonight. I'm going to just kind of introduce myself. Most of you already know me, but I'm Catherine Pickett, registered nurse here in the city of Huntsville, Alabama, and this is my room, Cat's Corner. Now, my goal is to bring on professionals and to provide information to help us all live a better life. This month is Women's History Month. So I wanted to bring someone on that could help us as women to take better care of ourselves. Because, we take care of everybody but us. That's generally, we put ourselves last. So I wanted to bring on a professional, and this woman right here, and I'm going to give you a little bit about her bio, but if I really tried to give you all her bio, we'll be here all night. So I'm going to hit the highlights of her, but she's an awesome woman. I know her. I've known her personally. And y'all hold up, because I touched this thing, and as usual, every time you touch it, it go to something else, because all of the pop-ups. So I'm there. So I've known Dr. West for quite a few years, but what I do know about her is she is an excellent OBGYN, knowledgeable. So I'm going to give you just a little bit about her before I bring her up, because I do want to have a little time in case if there are questions. But the person that's going to educate us tonight is Dr. Whitney E. West. She's a board certified OBGYN, and for more than 20 years, she's been showing up for women across Alabama with heart expertise and a deep belief that exceptional health care should feel personal, not transactional. She is a board certified OBGYN and fellowship trained integrative medicine physician. She's built her career around listening deeply and providing compassion, evidence-based care across every stage of a woman's life. And y'all, that is so important for us. So Dr. West first considered becoming a veterinarian. She's always had a thing for nurturing, but it wasn't long before she realized her true calling lay in supporting women through some of life's most vulnerable, complex, and empowering experiences. So from annual exams to robotic surgeries, birth control to menopause, she brings both advanced clinical skill and genuine humanity to every patient encounter. But tell you a little bit about her education, then we're going to get on. She earned her Bachelor of Science from Howard University, graduating magna cum laude, and received her medical degree from McHarry Medical College, where she graduated summa cum laude again. She completed her OBGYN residency at the prestigious hospital of the University of Pennsylvania, an experience that shaped both her clinical experience and her patient-centered approach. But what I want you all to know, all of that is great, but this is a woman you can trust, y'all. This is a woman you can trust to look after you and your health. So without any further ado, Dr. West, I want you to come on and help us out with ourselves.
Good evening. Good evening, everybody. Thank you for having me. I just tell you a little bit about myself that Kat didn't mention. I've been in Huntsville over 25 years, but I'm originally from Philadelphia, so my transition from the north to the south was kind of dramatic for me. But here I am now, 25 years later, and now I call Huntsville, Madison my home. So I'm happy to be here.
Well, we're happy to have you, Doc. And I'm going to jump right in because, as I said, I want to be, conscientious of everyone's time and kind of how this is going to go. We're going to just go through some questions. But, Doc, anywhere you want to interject anything outside of these scripts that I'm going through, please feel free to do so. And then at the end, if we have questions, we'll let them talk and get, to ask you some questions. So, I thank you so much for being here. But one of the things I wanted to just kind of start off is, and I already mentioned it, as women, and we can relate, we put ourselves last. And in doing that, we put our health last. And that's where the problem comes in at. So I wanted you just to elaborate on how, just some of the things, what are some common health issues that you see us putting off and ignoring?
So there's several. I actually had a conversation in the office today with a patient, and she, caregiver, which is mainly the reason, one of the main reasons, first reasons that women put themselves last is because they're making sure everybody else is getting where they need to go. And they're not paying attention to their own symptoms, or if not even acknowledging that they have them. But some of the top ones are, heavy periods, irregular heavy periods. Fibroids are common in women of African descent. And there's in families and, women in women's circles, they talk about, they're bleeding. And a lot of the problems that I see with women is that they normalize things that are really almost traumatic for them. They make it seem like it's okay. So there's, it's been a transition in the world, because, we're in 2026. So over the last 25 years since I've been here, there are some things in this society that were frowned upon 25 years ago that now are accepted. But for us, especially women of African descent, we normalize a lot of things. We take on a lot of things and call ourselves multitasking. But what we're doing is compounding the trauma and the stress that we have to handle, because we allow it. But irregular bleeding, pelvic pain, fatigue, and now perimenopause and menopause are hot topics, not because they weren't topics before, but now because people are making noise, like the squeaky wheel gets the oil. So now there's a lot more information out there about menopausal symptoms, and there's a lot more education that needs to be had for at least a lot of docs, and they women are trying hard to find those people who are well versed in that. So but the symptoms that come, during perimenopause and menopause actually feel like other things. So if you're having symptoms and you don't feel like your primary care doc is listening, or they're trying to send you to 5 different docs, ask yourself, when's the last time you've seen your gynecologist, and make an appointment, because the 5 or 6 things that you have going on may seem like they're different in different parts of your body, but they all could be related to being perimenopausal or menopausal symptoms. And then getting your annual exam. Like, a lot of people just don't go. Like, I have folks in there, it's been 5 years or 10 years or even 20 years. I had my last kid and I didn't think I needed to go back. And it's absolutely important, especially those women who are going through transition, different stages. So you no longer having kids, but you still need to be seen, because there are other things that happen in your system, and your sometimes the gynecologist is the first person to notice some things that are happening. So those are like the top 5 or so that I think I've seen, maybe more recently. But it is absolutely important for women to take time for themselves and to pay attention to what's going on with them, because you can't be any good to anybody else if you're not okay yourself.
Wow, that's good, Doc. Thank you for that. So, what do you think is part of, other than just trying to be everybody's hero, their family, because we feel like we have to be. I mean, we're the moms. What do you think is our drawback? Are we just sometimes I feel like even with myself, it's like sometimes it's like I don't know if I want to know uh what's going on, because it could be something detrimental. Sometimes we are afraid of what we're going to find out, or we think it's just going to go away. So, what do you think our biggest drawback is there about not, other than trying to take care of everybody else?
So you just said it, fear and anxiety, right? Anxiety over actually getting the exam done, or actually finding out what the answer is. There are actually a lot of people who would rather not know if they had cancer than those who would, right?
Right.
Because then, well, what are we going to do about it? Oh my God, I've got cancer. I'm going to die. So I will tell you this one thing. So cervical cancer is one of the only cancers that actually can be cured if caught early. So if you're following up with your Pap smears on a regular basis, then you'll be the one. If God forbid something happens, that it's going to be caught early. The unfortunate thing is some of the other cancers that women get, breast, ovarian, sometimes either go unchecked or there isn't even a test to screen for. Like for ovarian cancer, there isn't a screening test for that, and the symptoms for that, for ovarian cancer, feel like other things. You get a lot of GI complaints, so abdominal bloating and nausea, and that, so you end up going through the whole GI workup, and it's not that. And so there's a delay in care and that kind of thing, which is again very important that as a woman you keep a gynecologist in your repertoire, right? You make sure you have a primary care, but you also see your gynecologist. And even if you've had a hysterectomy, if you still have ovaries, then you still need a pelvic exam when you go to get your annual. So somebody should be laying hands on you to make sure that there have been no changes, and you can tell them if you've had any weird symptoms that you need to discuss or something like that. But not even so much just the fear of finding out that you possibly have cancer, but some women I can't find the time. Like I don't have time because you busy doing other things, and they don't consider their health to be a top priority, which is really sad and unfortunate because that means everybody else is more important than you are. And then some women have issues with actually access, like actually getting in to see somebody. So let's say, they may not have seen let's say it's an insurance issue. They don't have insurance, or they saw their obstetrician with one kind of insurance and they don't take that insurance now because they're not pregnant, and then so they can't get in to see somebody else, or there's a backlog. You call somebody and your appointment is out 2-3 months, and then you forget about it and you don't end up going. So access is really huge. And I'll tell you now, with the way healthcare is and insurance plans and that kind of thing, deductibles, high deductibles and stuff like that, there are people who don't understand that they have to pay out of pocket for most of their care because their deductible is so high. And one thing I mentioned earlier, one of the other reasons why folks don't go is because they've talked to their sister, cousin, friend, or neighbor, whatever, or their mama say, girl, I had the same thing. It'll go away. It'll be fine. When it's not okay, it's not fine, and it's not going to go away. Just because somebody else in the family had it doesn't mean that it's the same. You're having the same issue, like it's exactly the same, or that what they were having is also not a problem, right? They probably should have been seen too, and they didn't go, and now they're in a worse state than they could have been had they been seen by somebody. So, again, those are really the top big ones, like the top ones: fear, time, taking the time, having access to the care that they need, and then just normalizing things that are really, really not normal.
Wow, that's good. Doc, I have one of my favorite nieces actually passed away from cervical cancer, and it just wasn't caught early. And we lost her. She fought a good long battle, but just to think that that's one that if it's caught early can actually be cured, can actually be something can be done about. That's mind boggling, that could have may have been avoided. One of the other things I wanted to tell us what a well woman visit would typically include. So maybe this will get some of the stigma off of it.
So in general, well woman also means annual. Physical for a gynecologist is different because we do all the bottom stuff that the primary care doctor doesn't do. But in my office, a well woman visit includes, history. We get a lot of information, make sure that we, address if you're a recurring patient, then we talk about changes that have happened since the last time we saw you. And then as far as the exam goes, we do, I always listen to the heart and lungs and check for thyroid enlargement, breast exam, and then we do the pelvic exam. In the pelvic exam, a lot of people get confused because they think a pap smear is actually the pelvic exam. The pap smear is just a test, and it's a test for cervical cancer. And the pelvic exam is where we actually examine the pelvis, meaning that we put a hand in and we press on there, or we actually do the test for the pap, or we can do infection testing. That means sexually transmitted disease testing. Women who are menopausal, who are having vaginal irritation or bladder issues or whatever, we examine. Also, we can do a urine if they're having urinary complaints, and all of that is in that one visit. And the confusion comes, and I'm sorry to hear about your niece. I don't know how, you didn't say how old she was, but what has happened over the last I'm gonna say the last 10, 15 years is that there have been changes in the guidelines for how we do cervical cancer screening, which means that, if we read the governing bodies that help us as OBGYNs, do care, there are changes in how often we do testing, what tests we actually look for, and there's some confusion, especially among like primary care docs, that you only need a pap every 5 years, or you only need, so people are going 2, 3, 4, 5 years between examinations, not just pap tests, right? So you still need to be seen, but whether you do the pap and what kinds of pap tests you do can be determined when you're seen annually. So I never let my patients go more than a year between appointments, because life changes, like lifestyle changes, especially if you're younger, you're not married, you may change partners. If we're on birth control, you have to be seen, because we will not refill the birth control if you're not coming back. If you have a long-term birth control option, like implant in your arm, the Nexplanon, or an IUD, they last between 3 and 8 years, depending on which one you have. So some people think once they have that in, they don't need to be seen, but you absolutely still need to be seen on an annual basis, whether you get a pap test or not. A lot of women need to learn how to do their own breast self-exam. A lot of women don't do that, especially if there's breast cancer in the family. You need to know what your breasts feel like. And real quick, 5 days after your period goes off, is when you do your exam. I usually give out handouts to tell you how to do it, but it's literally just in a circular motion. You start from the armpit and you go inward to the nipple, squeeze the nipple gently. If anything comes out, then that needs to be addressed as well. But if you don't have a period for whatever reason, then you pick a day, the 1st, the 15th, the 30th, and you do your exam the same time every month, so you know what feels normal for you. If you drink a lot of caffeine, you're going to have bumpy breasts, whether you having a period or not. because caffeine has been known to cause what's called fibrocystic breast disease. You may also have breast tenderness if you drink too much caffeine. So if you're having any of those symptoms, then just back off on your coffee or your sodas and then see if that helps to get better. And if it doesn't, or if you have a lump that hasn't gone away, then you need to absolutely be seen. I've had some women whose partners found their lump because they do the exam for them. So if that's a thing and you feel more comfortable letting your partner do it, then do it. Just let somebody do an exam on you. You should have at least one clinical breast exam a year. But as far as the exam goes, that's pretty simple. Now, I'm really cognizant of patients who either have never had a pap smear done and they're really nervous and scared or whatever, and then those who are either not been sexually active, or it's been a really long time, just because the exam is pretty uncomfortable. Because my first exam was horrible. The woman I don't think she was a nurse, I can't remember who it was, but she was very rough and very non-compassionate. It was an awful exam. So I'm very mindful when I do an exam on someone that I know how they feel. Like I know how they feel. So I treat them way differently than I was treated when I had my first exam.
Okay, now see, that's awesome. So this is something that, and I thought about this as you were talking. Hold on just a minute. Keep high level. I was thinking about something, and somebody walked into the room, kind of threw me off. So when what our body needs changes as we age, right? So here I am in my 60s. But what about like in the 40s? How do what we need and how often we need to be seen change as we age? Or should we still be coming every year?
I didn't hear what you said.
Oh, I'm sorry. I said, tell me, like, at my age, and then there are women in their 40s, women in our 50s, how does it change as far as how often we should see our OBGYN as we age?
As far as, let's see, the testing that's done while you're there. So let's start 40s. So let me go back. I usually do a baseline screening mammogram at age 35. If that's normal, then you don't need another one until you're 40, and then we do one every year. And that's through, I think I do up until maybe 80, and then we kind of back off after that. When I talk to patients, so they've dropped the age for colon cancer screening, that's 45 now. So, and depending on what your history is and what is found at your first exam, your first colonoscopy, then they'll tell you usually 3, 5, 7, or 10-year follow-up. And 10 years means that they found nothing. 3, 5, and 7 will be determined by your family history and what they found, polyps or whatever. That's the colonoscopy. And I always ask patients about that. I make sure that everybody's up to date on all of their screenings, especially the ones that I don't do for them. So I make sure that they're in touch with the people that they need to get in touch with. Bone density has evolved. So I used to only just do at age 65, because that's when the insurance would really cover it, like they would cover it. Now there's really a push to start doing bone density screening, and that's screening for osteoporosis in women who are menopausal. Because we now know, and we've known for a long time, that the lack of estrogen it changes your bone density and structure. So you're at higher risk for osteoporosis as you age, and then you become menopausal and you don't use hormone replacement. So as your estrogen level drops, then your risk for osteoporosis goes up. So those are the tests that get done. When they get done, like I said, 40, we get a mammogram every year. And I will see my patients every year whether I do a pap test or what kind of pap test I do. And there'll be some changes coming up in the next few years. I think they just convened on some kind of consensus or whatever, and they're going to talk some new guidelines or something like that. But what they're talking about is actually HPV testing. That's human papilloma virus, which is the vaccination that the kids should be getting between ages 9 and 11. Now they're marketing it to go all the way up to, I think, 45. And I think that's marketed more in people who are high-risk populations, like who have anal sex and stuff like that, because of the risk of HPV infection and stuff like that. But your kids right now, if you have children or grandchildren or whatever, when they go to the pediatrician should ask them whether they want the parents, obviously, whether they want the child to get the vaccination for HPV. And I hope that you guys are allowing your kids to get the HPV vaccine. I'm not I'm definitely for vaccinations. I'm just not for COVID. So that's a whole nother story. We talk about that on another day. But HPV vaccine is actually very important. And we need to get it as early as possible before like the first intercourse has happened, because that's how we catch all of them, because there are 100 different types of the human papilloma virus. 14 of them are considered high risk associated with cervical cancer. The vaccination actually you're vaccinated for, I believe, 9. It's Gardasil 9. So 9 of those 14. But even of those 9, there are 2 that are associated with 70% of the cancers. So you absolutely want to get that before you get exposed to anything, and that's through sexual intercourse, basically. And so you want to get the HPV vaccine. So going back to the cervical cancer screening, a lot of people, they heard that, well, you only need a pap smear every 3 to 5 years, and that's HPV testing. That's not technically the pap test, okay? It's definitely not the pelvic exam, and it's definitely not an annual exam. You should be seen annually, whether you get a HPV test or not. And that is only for those people who are completely low risk, who aren't changing partners, who've never had an STD ever in their life, who don't have other medical problems. Because I will tell you, those who people who are HIV positive have higher risk for cervical dysplasia. So that's not somebody who can go 3 to 5 years without being seen. So it's important for your physician to know your full history, and to base their management on you based off of your individual situation, and not what the textbook says or not what the guidelines. I mean, they're guidelines, right? They're not. It's not a rule book necessarily. It doesn't say this is how it has to go every single time, because every patient is different. So your management of that patient should be based off of their individual situation, not a blanket statement generalization that this patient actually doesn't fall into.
So that's one of the things that really brings it home, that we should be transparent with our physicians, our OBGYN especially, with period. Because if you have the information, you're able to treat us more thoroughly. So, and to tell, to guide us on how to care for ourselves. One of the questions I wanted to ask, because and I've seen this, as a nurse and treating people over the years, how women, especially women, after they get a certain age and they're going through menopause, but they still have partners and may very well be still sexually active. What is happening with it when we start to have so much problems with being able to not, our bladder, whether we have incontinent episodes, that type of thing? And what can we possibly do? Who should we see about it?
So there are symptoms that you can get when you become perimenopausal into menopause. that, again, like I said before, will mimic other problems. Like, so there's about 100 different symptoms that women can have that are actually because of being menopausal. And then what we're talking about is a decline in the hormones, estrogen and progesterone. But we also look at, a couple other hormones, cortisol, your thyroid, obviously testosterone, so we look at all of those to see kind of where you are. When you are menopausal and you're not on hormone replacement, and that means you've been given back the estrogen and progesterone that you've lost in menopause, that means that the parts of your body that are managed by those hormones are now going to be affected. So I'll tell you, estrogen affects 400 different functions in your body from head to toe. So when you don't have it anymore, then those 400 functions potentially are out of whack, right? So if we start from our head, we got some people get migraines. We get sleep disturbances and mood changes and hair loss, hair thinning. If we move down a little further, we can have issues with our skin, our heart rate. Like sometimes we'll have palpitations. We get more belly fat, more weight around our hips, because the distribution of your fat changes when you go through menopause. So weight gain just in general. You get problems with your bladder because estrogen is a major component for managing the vaginal tissue and the urethra where you pee from and stuff like that. So leaking and peeing more at night is really huge in menopause. Like you get up to gotta pee and you didn't even drink anything and you still gotta go, right? So a lot of people, the sleep is disturbed because you gotta get up to pee. But leaking comes from not just menopause in general, but if you've had kids vaginally and you've had big kids and you've had damage to that tissue down there, then you might need pelvic floor therapy, Kegels exercises, and if it's really bad, you actually might need some surgery with a urogynecologist. But as far as where you go for your care, you can start with your primary care doc. If you think it's just a routine urinary tract infection, but if it's something that has been plaguing you like for a long time, then absolutely go see your gynecologist, because your primary care doc at that point is just going to either hand you some antibiotics all over again or send you to the urologist, when not only do you have bladder issues, but there might be 10 other things that you have going on that would be treated if you saw a gynecologist who then recognized that you were in menopause and then manage you appropriately.
Thank you so much for that. That's good. Are there any like dietary supplements or anything that you would recommend at different stages to help as we age with our hormone imbalance, our bone density, the things that you've been talking about? That's going to happen as our body changes. Are there any dietary supplements that you use or recommend in your practice with your patients?
So I do, but it's limited. And I'll tell you this. I'll tell you why. Now, we know a lot of brown-skinned people are vitamin deficient because we don't absorb the sun like non-brown people. So it's important to check that, like have it checked and then replace as necessary, right? Sometimes it's so low that you need a prescription strength and then something for maintenance. In addition to that, I'm not a fan of a multivitamin because you're trying to take it's like 35 different things in this one tablet, and there's no way that you can get full absorption to an optimized level with one pill trying to get in these 35 different things. Some of them require you to eat with, some of them require you not to eat with, some of them interact with each other, so you got to be careful of that. there are a lot of women that I've seen recently who've had B12, vitamin D deficiencies, and those you can easily get, in diet. And I always say you cannot supplement a bad diet. You cannot out supplement a bad diet. So your body wants you to get it in the whole food, right? So it's better if you eat it and it's broken down properly and absorbed into your system versus you trying to take 25 pills instead of eating the food, right? So because your body processes supplementation way differently, so you don't get all that you're swallowing in that capsule because it's going to be processed and broken down and eventually absorbed. But if you eat the food, then you'll get what what you're supposed to get from the food. But I do supplement when vitamin D is low, B12. I'm really big on those two. And then I talk about omega-3, and that, a couple easy sources to get omega-3 in, wild-caught salmon, black cod, and walnuts, flaxseed, chia seeds, that kind of thing. You can get omega-3 from that. That can help with cholesterol and stuff like that. But as far as blanket statements for, everybody, no, I do not. I check them, check the supplements that I'm looking for. I listen to their symptoms, and then we, if we need to, replace as necessary. And then I always talk to folks about changing their nutrition. So we got to eat the food that we need. And women over 40 need more protein. They need strength training as opposed to cardio. So please don't go run an hour on a treadmill and think you've done something. All you've done is worsen your condition. So more strength training versus cardio for women over 40.
All right, thank you for that, because we definitely don't want to worsen it. It's enough as we age what we're here going through. The other question that I had, and in just a few minutes, I'm gonna see if we got any questions. So, what changes typically are we gonna start seeing at perimenopause?
And this is going to be different for every single woman. But if you still have a uterus, irregular bleeding, that's probably number one. There are some women who have some mood changes. They feel like they're more either emotional or irritable around the time of their cycle, or more so all the time. Sleep disturbances, urinary issues, sex drive changes. Some women get, joint pain, which is interesting. Frozen shoulder. They notice hair thinning, skin, dry skin, that kind of thing. And all these are going to be on kind of a spectrum, right? Because it's not all going to happen at the same time. You're not going to have all the symptoms, like all 100 of the symptoms at all. Some people, will have like the hot flashes and night sweats that'll come and go. And then they won't have it for a while because, during the perimenopause means around the time of the menopause. And then menopause means that you have gone through the process of no period for 12 months straight. And so that's the textbook definition. Now, depending on whether you had a hysterectomy, you had your ovaries removed, all those things are going to, change some of the symptoms that you're going to look for, because you're not going to have irregular bleeding if you've had a hysterectomy, but you may have some of the other things. Like I said, hair thinning before, weight changes, anecdotally, I've had patients who came in and said, I gained 15, 20 pounds in like 1 month and I didn't do anything different than I've been doing. Right. Or I can't sleep, or I wake up every night at 2:00 in the morning. And that just started. Or my husband's, he stays away from me because I'm a little cranky, or, stuff like that. So, but there's, like I said, there's about 100 different symptoms. Migraines. So I have a lot of patients that have gotten migraines that never had headaches before, and all of a sudden they got migraines. So if you are experiencing any of these, what you would consider weird thing. And I tell you, this was one weird one: itching across your shoulder blade, like this tingling, itching, weird sensation, or the bottom of your feet get hot. Those kind of like weird things that are happening to you, like out of the blue, could be menopause related. So if you went to your primary care doctor and they want to send you to 5 different specialists, go to your gynecologist first. don't go to the 10 different specialists, because they're going to try to treat you for the individual condition versus, like I said, it could just be menopause related and you just need some hormonal balance and balancing.
So, and to actually find out about that is really blood test. Is that really what just you do blood test to tell it and find out what we need?
Yeah, so for me, it's history first, then it's blood work. And so history, that gives me all the symptoms and the timing and all that kind of stuff. And then blood work. And then based off of that, then we go from there.
Okay, and I'm going to give them a chance to ask questions in just a minute. So if you guys have any, go ahead and just, get them on your mind. I want to be conscious of everyone's time today because I wanted to keep this for an hour. But one of the things I want to get clear, because this is something that I've noticed myself. Oftentimes that you said the itching across the shoulder blade, can it come with a rash?
Not typically. It's just like a tingling or itching right across the shoulder blade. It comes and goes. So not typically with a rash. If you got a rash, and there may be something else going on.
Okay.
But just, like I said, these are, kind of off the wall kind of symptoms, and you're not sure where they're coming from. But in combination with the other things like irregular bleeding or no period at all, and hot flashes or night sweats, and then bladder stuff, and then low sex drive, and then, oh, by the way, I've got this tingling and my shoulder is tight, and I've got joint pain that just started, and I gained 15 pounds in a month. Then all of those together kind of sound like menopause.
So what are just a few foundational habits you would say that we can do to support our hormone balance?
First is diet. And I mean your nutrition. I don't mean being on a diet, because I don't like that word, because you're always going to get off of it, right? And go back to what you were doing before. So every time I talk to any of my patients about changing their nutrition, I call them lifestyle modifications, right? Mm-hmm. So we're making slow changes, consistent slow changes that we can live with for the rest of our life. So that means paying attention to what you're putting in your mouth, right? So if we're eating a lot of takeout, a lot of fried foods, a lot of things that are super ultra processed with sugar and chemicals and things in it you can't pronounce, then you've got to make a change, because those could be contributing to some of the symptoms that you're having, and can't always blame your hormones, right? So eating whole foods, like the actual food, versus liquid diets and stuff like that. It's better to get the whole food in. Use your gut so it does what it's supposed to do to break down the food and get it where it needs to go. Make sure you're drinking enough water, right? We got to drink enough water, and we got to stop drinking things that have a lot of sugar in them or fake sugar. Things that say sugar-free typically have some man-made sugar in there, and it comes with probably 15 different names. So they'll change the name on there, and you'll think I'm good because it doesn't have sugar in it, but it actually does. It has artificial sweeteners, which are way worse for your body than actually natural sugar. So those are like the two big things. Like I said earlier, women over 40 need more protein. And an easy way to calculate is your weight in kilograms times 1, right? So we do 1 gram times the kilos, right? So if you I was going to tell you, I probably need to be eating 120 grams of protein a day, broken up into meals and snacks. in a easy rule of thumb to get 20-25 grams, of animal protein in is about the size of your fist, right? 4 to 5 ounces is about 20 to 25 grams. So if you're trying to calculate that, then you think of what you can eat for your breakfast, what you can eat for lunch, and what you can eat for dinner. That will give you about 20 grams per meal, and then you get a couple snacks in. And so we're talking cheese, or like a mozzarella cheese with some pepperoni or something, like you can come up with some kind of combination to make your snacks, and then you got your meal. So more protein, more water, whole foods. And then one big thing that I've noticed that a lot of women my age are doing, and I'll be 55 on my next birthday. So is skipping meals, right? So if you're not intentionally doing intermittent fasting, and that means that you don't eat for a certain period of time, and most people do 16 and 8. So you're fasting for 16 hours and you eat in the 8-hour window. That's intermittent fasting. But that also means that you got to get all your food in that 8-hour window. And most people don't do that. They end up eating maybe one meal or two. That means they're not eating enough. Or they're just skipping meals in general. I ate my first meal at 1 o'clock and my last meal at 8, and I go to bed at 10. So you're eating and then you're going to bed. You haven't eaten enough. You ate some junk, and then you're going to fast again until after lunch, and your first meal is junk meal. So we need to be mindful of that, right? What we're putting in, because what you put in will come out as well. So you need to be eliminating at least once a day. It really is 3 times a day, but once a day you should be eliminating. If you're going twice a week, then something's wrong and things aren't moving out, and that means you're holding on to toxins. So we gotta eat better, whole foods. You gotta drink water, get enough protein in, and then we gotta get activity in. And like I said, for women over 40, we gotta do strength training, because we start to lose muscle when we become perimenopausal into menopause. We lose muscle, and we lose muscle strength. So we've got to build that up.
That's awesome. That's one of the things you said that is, to me, is so key. And I've heard it said over, well, you don't have to go every day. So I'm thinking, so what? They're supposed to just stay inside and sit there?
Yeah, I got folks that go once a week, and I don't know how they living. I don't know
how. I'm like, this doesn't, it just kind of make it make sense when they tell you you ain't got to go every day. Oh yeah, I think I do. Okay, all right. So guys, this, I know we're at 54 minutes before the hour. So I wanted to give an opportunity, if there's anyone is on the panel. If you have a question and you're not on the panel, we can bring you up. But is there anyone who has a question for Dr. Whitney here as we come to the end? Because I'm going to let her tell you how, you could get in touch with her if you were to need to, or if you're local and want to see her. I recommend people to her pretty often, because especially who I know need to see, but who doesn't have one or has problems, especially. I recommend them. So does anyone who has questions, if you're on the stage, like Rochelle, if you got a question, you can open your mic and go ahead and just, address her. Are there any questions?
Thank you for giving me the opportunity to speak. I just wanted to say thank you for everything that you shared tonight, Dr. West. It was very informational. It was very encouraging. I thank God for medical providers like you that stand in the field and actually care about your patients and care about your patients on levels. So continue to do what you are doing, and I pray there be more like you, and we cover you as you continue to do the work that you are called to do. And I'm done speaking.
Thank you. Thank you.
Hello, doctor. I am so grateful for you sharing this information. As a woman in my 50s, I was told by a doctor that I didn't need to get a pap smear every year. So I just thank you for sharing that. And I'm definitely going to have a hard conversation with my daughter to make sure that she just reaches out to other doctors just for misinformation, because I really did not think I had to get a pap smear every year. So I appreciate you sharing this, and I definitely would love to get more information or your contact information, even though I'm in Georgia. But I learned a lot tonight, and I thank you so much.
Oh, you're welcome.
Are there anyone else that have questions? I don't want to miss anybody. Well, awesome. So, Doc, if you would just share with people how they could reach you. And one of the things I did want to ask myself is we're coming up, we're having a women's conference in September. And I'm going to do some like gift bags for them. What is the one thing for women? Because we're having a prayer conference. And I'm gonna be talking to them a little bit about our health, and we're gonna be doing some devotional stuff, because I do like my morning with God, and we're gonna do that. But I want to give them some gift bags with some things about that's gonna keep, for their health. I was gonna ask you about that anyway. See what you got out there for me that I can put in those bags.
One thing. I don't think there's one thing. If you want to put a card in there that says self-care is not selfish, because
that's good.
Women need to give themselves permission to take time to recharge, recuperate, replenish, because most of the time we're out, because this is how we started this conversation, right? Women who aren't taking care of themselves, and we don't take the time to sit with ourselves, or commune with God, meditate, pray, whatever your whatever you do, you got to take time to replenish the well, because you are run dry, right? And you cannot give what you don't have. So, and you can't be your best self if you give in to everybody else and you've not, replenished what you no longer have. So you can't be good to anybody until you've done that. And I think it should be done on a routine basis. And I'm talking to myself now, not just you. I'm talking to myself. I think there should be a regular schedule of that. If it's a 30 minutes once a week, or every third Saturday you go get a massage done, or whatever, you go somewhere, whatever. But there has to be time to replenish. And like I said, self-care is not selfish. It is absolutely important for you to continue being who you are.
That's good right there, Doc. I'm gonna put that on a card, and I'm gonna get with you on the backside though about like maybe some pamphlets or something that you have out there that I could put in our goodie bag. Renetta, if you have a question, I have just invited you up, so if you can definitely come up and ask your question. And is there anybody else? Yeah, there she goes. All right. So you can unmute and ask your question, and then I'm going to go ahead. We'll get ready and close the room. I know she had a question, and she may be having trouble. Just touch your mic, and it will open it up. That little microphone with the line across it.
Okay, I'm sorry. I see it now. This is new to me here, so appreciate you inviting me on. Great information, especially when she talked about, Doctor, you talked about menopause and your health and taking care of you. I'm retired military, and after all those years, when I decided to get out because my mom passed, my sister passed, my dad passed, everybody passed, I didn't take care of me until right before I retired from the military. I'm like, wow, because I was taking care of soldiering than I was myself. And then once I finally got out, I started taking care of me once I got here to Huntsville. And my daughter asked me one time, she said, Mama, what's all those pills you got? I said, this is what the doctor gave me. For bleeding, for headache, backache, toe, you name it, I had it. I had a pharmacy up in here. Until a couple of years later, I changed my diet to go plant-based. And I could tell a big difference. Much better. My hair is not thin anymore. It's growing because I had alopecia. You name it, I had it. And here I am, 58, finally taking care of me and my body. Now taking care of my husband, make sure he's straight, you know. But it's so true about the stuff that we need in our bodies, all right here. It's natural remedies. Get outside, get some fresh air, sunlight, vitamin D, you know, drinking, you know, water, temperate water, not cold water. Get up in the morning, drink warm water to fresh your system out with, you know, all those toxins and everything, what have you. So now I'm learning, I'm growing, and I'm able to pass on to my daughter. She's 24, my son 26. So now we're better together now, and we're doing things that's beneficial to us because, like I said before, I was taking pills after pills where I was getting addicted to them, you know, taking pills to wake up at night, taking pills to go to bed at night because I had PTSD, depression, you name it, I had it. And thank God I was able to contact with someone or bodies or family member that's Seventh-day Adventist. And my uncle told us, you know, everything you need is all natural. It's right here. All natural. I mean, no more white, nothing. Everything is wheat, grain, chia seed, black seed, you know, stuff like that. So it works, and I appreciate you. Even with the talk about the hormone, I finally got a chance to see a doctor here. The VA got me into a doctor here, and when I saw the doctor here, I told her what was what. You know, I'm having hot flash, I'm sweating, whatever. My hair thin, what have you. Oh, I got you. Take this, take that. 3 different medications she gave me, and I turned around on the backside of it, look at the side effect. I like, oh heck no. One was a patch, another one sticks them up your rectum, and another one was something else. All had some kind of side effect. And I tried out the patch on my leg. And the next day or two, I started feeling bumps, and I thought, oh no, I'm done. No more. So it's best to do your homework and find out what the symptoms are. Get the root of the cause of what's going on with your body, and then go from there. Because there's so many natural remedies that you can take. It's right there in your pantries. Cut back on your butter, your sugar, your white stuff, and all that. You name it. No more here. Everything is just, I'm smooth sailing now. I feel much better and lighter now, you know. No more fast food eating. We cook all our food, you know. So it's just a blessing, and I appreciate you with the information. It's just a confirmation that, hey, keep doing what you're doing. Thank you so much.
Yep, thank you for sharing.
Awesome. And one more alibi. I'm sorry. I'm a troop leader, Girl Scout troop leader, and every 2 years, this is our 3rd year now, we do event for women of color cancer patients. We put on an event for the women of color with cancer patient, and our girls, 6th and 8th graders, we make natural lotion or scrubs for them they can use for their body, and we present them like gifts and stuff, whatever, like Miss Catherine was saying, would be a nice gift to give the women besides little pamphlets or what have you, you know, that they can use. So
awesome. And then I'll get with you about those scrubs then, okay?
Okay, then I appreciate it.
I am looking for some things to go into my bags. Y'all, I am so thankful for everyone who's attended. I know I learned a lot. I learned a lot every time I pretty much talked to her. So I hope you all learned a lot. I hope you gained some information tonight, because truly my goal is to make us all better. But Doc, one of the things you said about that getting a way to be able to clear our head and getting our rest. The way I met Rochelle here on the panel on the bottom was on a podcast, and I was talking about vacation is medicine. She never even saw my face, but she sought me out, and that was almost 3 years. Well, that was 3 years ago, and she and I are still friends right now because of that that very topic, the importance of it, because it's documented. Y'all, even Jesus rested. You tell me we don't need to get some rest? Yes, ma'am, we do. So, Doc, if you would, to get ready to close us out, just kind of let everybody know how they can connect with you if they like. If you're taking new patients and that type of thing, and then we'll get ready to close this room. But again, I thank you so much, and it's been awesome.
All right, you're welcome anytime. So if you're local here in the Huntsville, Madison area, I'm located in Madison. My address is 550 Sun Temple Drive. It's about not even a quarter mile from Bob Jones High School, if you know Hughes Road. If you want, my website is www.www.westmdpc.com. And that's my website. So you get information. If you're local and want to make an appointment, you can request an appointment through the website there. One other thing that I wanted to point out for those who aren't in town, I actually have a podcast. It's called the Integrative GYN, where I'm talking about, women's health. And the conversation about menopause is necessary, and it hasn't been happening up until recently. So I'm actually I'm breaking down all the different hormones that we look at, what happens to your body and all kinds of stuff. Not just menopause, but just a lot of different topics that I'm talking about. So if you guys are interested in hearing a little bit more information and in a little bit more detail, then you can check that out. I'm on Apple Podcasts and Spotify right now. So it's called the Integrative GYN. What else? I can give my number. It's 860-337-9378. If you want to call and make an appointment, you can do that as well. So, but thank you for having me. I appreciate, my goal has always been to educate my patients. That's been my entire career. So thank you for giving me the opportunity to do that.
I just thank you so much, and I want you all to know that we are going. I've talked to her about coming back again. There's a topic that's really dear to my heart because I have a family member who suffers with it, and that's PCOS. And but that's a subject all on its own, and that we're gonna have to talk about. So we're gonna have another one whenever she's got the time, and I can get her on because I know she's busy. But we're gonna delve into that one to see, the things that are causing it, what we can do to help ourselves with it. So this has been awesome. I want to thank everyone for coming out tonight, and I want you to make sure that you join Cat's Corner, because I am up again and running. I'm going to do it all through the summer months. I'll be bringing on specialists at least monthly, maybe sometime twice a month, and we're going to be talking about what we can do to make our lives better. And that's what it's all about, so that we can all help, each other, and just help to we have longer, better lives. So I want to thank you all for coming. Oh, thank you, Rochelle, for posting that at the top. This is the website, and how you can actually go directly to a website. You can copy that link right there. So Rochelle, if you will, let's close our room out. And I thank you all for coming.